Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, so think about this for a second, right? Millions of kids every year end up with some kind of head injury, serious enough to be called a concussion.
Oh, yeah, absolutely. It happens all the time.
And, it could be from playing sports or, just kids being kids.
Right.
And so often, like, as parents and, just as a society, we kind of assume that once those really noticeable symptoms are gone, things like headaches or feeling dizzy, we assume that once those are gone, they're good to go.
Yeah, you just assume they've bounced back totally.
But what if it's not that simple?
Yeah.
What if, actually getting back to feeling like their old selves takes a lot longer than we think for these kids?
That's a really, really important question, and it's what we're going to be looking at today.
Yeah.
Because while those initial symptoms, those are the ones that are super obvious and we notice those first.
Yeah.
There's this new research that took a much deeper look at what a full recovery from a concussion really means for a child.
Okay, I like that.
So they went beyond just asking, is the headache gone? And instead, they were really trying to understand how long it actually takes for these kids to kind of get back to doing all the things they normally do at their best.
That's fascinating.
Yeah.
So today we're doing a deep dive on this topic of recovery after a child has a concussion.
Absolutely.
And we're really going to try to understand the true timeline for recovery. And we're not just talking about, feeling better physically, like we said.
Right.
We're going to be looking at a study that examines this idea of optimal functioning across all aspects of a child's life.
Yeah.
And I think the findings are going to be pretty eye-opening for a lot of people.
Oh, yeah, for sure. They really are.
So to guide us through all of this today, we have this health news article that does a great job of reporting on this really important research.
Yes, and the actual study itself is titled Optimal Recovery Following Pediatric Concussion.
Okay.
And it was led by Miriam H. Beauchamp at the University of Montreal.
Got it.
And it was published in JAMA Network Open, which is a really reputable journal.
Perfect.
Yeah.
So for everyone listening today, our mission is to equip you with a really clear understanding of how long it could realistically take for a child to truly recover after a concussion.
Yep.
And we're not going to stop there.
Okay.
We'll also be talking about what factors might actually influence how that recovery goes. And I think most importantly, we're going to discuss why this information is absolutely crucial for parents, teachers, and, well, anyone really who's involved in the lives of children.
Exactly, because it affects all of us.
Okay, so let's jump right in.
Okay, sounds good.
So first off, can you just walk us through the main purpose of this study?
Sure.
What were the researchers actually trying to accomplish?
So basically, the researchers set out to figure out how long it takes for kids between the ages of 8 and 16 to get back to what they called a state of optimal functioning after they've had a concussion.
Okay.
And what makes this study really stand out is how broadly they defined optimal functioning.
I like that.
It wasn't just about, like we said, are they physically healed? They took a much more holistic approach,
Okay.
taking into account things like how well the child's brain is working,
Got it.
their emotional state, their social interactions, and even how well they could cope with stress and what kind of support they had around them.
So it's not just, are they back on the soccer field?
No, not at all.
It's, are they truly themselves again?
Exactly. It's about the whole picture.
I see. Okay, so that's what they were looking for. What about the how?
Okay.
What methods did they actually use to study this?
So they did this type of study called a prospective cohort study,
Okay.
which basically means they followed a group of children over a period of time after they had an injury to see how they recovered.
Makes sense.
They had a really large group of participants, which is always a good thing in research. 967 children.
Wow.
633 of them had been diagnosed with a concussion.
Okay.
And they also had a comparison group of 334 children who had experienced other types of injuries, but not concussions.
Got it. So they had like a control group.
Exactly like a control group.
Okay.
And these were children who had orthopedic injuries, so things like a broken arm or a sprained ankle.
Okay.
And all of these kids, they were recruited from 5 different pediatric emergency research centers across Canada.
Okay.
And this was between 2016 and 2019.
So they followed these kids for, what, a few years?
Yeah, basically.
Okay.
Yeah.
So to be in the concussion group, though, what were the specific criteria?
So for a child to be included in the concussion group, they had to have experienced a blow to the head, and they had to show at least one sign that pointed to a mild traumatic brain injury,
Okay.
which is how the World Health Organization defines a concussion.
So like what kind of signs?
So this could include things like if someone actually saw them lose consciousness,
Oh.
or if they scored between 13 and 14 on the Glasgow Coma Scale.
The what?
The Glasgow Coma Scale.
Okay.
It's the scale that doctors use to assess how conscious someone is.
Oh, I see.
Or they had to have at least one symptom of a concussion right after the injury. Things like memory loss for the events right before or after the injury, headaches, dizziness, changes in their mental state.
So pretty classic concussion symptoms.
Yes, exactly.
Okay. And then what about the kids in the other group? The ones with the broken bones and sprains?
So for the orthopedic injury group, they had injuries to their arms or legs, but nothing involving their head. And like I said, it was stuff like fractures, sprains, strains, all caused by some sort of blunt force.
Got it.
And these injuries were considered less severe overall compared to a head injury.
Yeah, that makes sense. So were there any reasons why a child with one of these injuries might not have been included in the study?
Yes, actually.
Why?
There were a few reasons.
Okay.
For example, if a child had already had a concussion in the 3 months before the study started, they weren't included.
Okay, so it had to be like a new concussion.
Yes, exactly, a new concussion.
I see.
Also, children who had existing neurological conditions or pretty severe developmental disabilities weren't included either.
Okay, so they wanted to focus on kids who were typically developing.
Yeah.
Got it.
So that helped them really isolate how a typical child recovers from a concussion.
That's helpful for the research.
Yes, definitely.
Okay, so once they had these groups of kids all set, how did they actually track their recovery over time?
So they assessed the children at 3 different points in time.
Okay.
About 10 days after their injury,
Got it.
then again at 3 months after the injury, and then finally around 6 months after the injury.
So 3 check-ins, basically.
Yeah, basically 3 check-ins.
And during these check-ins, they were looking at this concept of optimal functioning.
Yes.
But how do you actually measure something like that?
Right. So that's the really cool part of this study.
Oh.
They defined optimal functioning using 11 different measures.
11.
11.
Wow. Yeah.
And these measures covered the 4 areas we talked about.
Yeah.
Physical abilities, cognitive skills, socioemotional well-being,
Okay.
and resilience and support.
Wow. That's comprehensive. So can you give us some specific examples of what they were looking at within each of those areas?
Sure.
Like what were the actual tests or questions?
So for the motor physical area,
Okay.
they looked at how physically active the kids were, whether they were still having any physical symptoms from their injury
Oh,
and their balance.
makes sense.
And then for the cognitive area, they used tests that measured things like their reaction time, how
Okay.
quickly they could respond to something,
Got it.
and their memory. And they also asked about any cognitive symptoms they were still experiencing.
Okay.
For the socioemotional part, they assessed their quality of life,
Okay.
looking at their physical health, how they were doing in school, their social relationships, and their overall emotional state.
Wow. It really does cover everything.
It does.
Okay. And then for resilience and support,
Yeah.
how did they measure that?
They used questionnaires
Okay.
to measure how resilient the kids felt and how much social support they thought they had from the people around them.
Oh, interesting. Okay. So they had all these different measures across all these different areas.
Yeah.
But how did they decide what counted as optimal for each one?
Right. So for each of the 11 measures, they had these specific criteria to determine what would be considered optimal.
Okay.
And when they could, they used existing guidelines or typical scores for kids of those ages.
Oh, okay. So like developmental milestones kind of?
Yeah, exactly.
Oh.
And in some cases, they actually used the average score of the kids in the orthopedic injury group.
The control group.
Yes, the control group.
Okay.
At that first 10-day assessment as a benchmark.
Oh, interesting.
So if a child met the criteria for optimal on at least 8 out of the 11 measures, then they were classified as having achieved optimal functioning overall.
So 8 out of 11.
Yeah.
Okay, that makes sense.
And they also looked at scores within each of the 4 areas, but only if the child had done all the measures for that specific area.
So they had to complete all the tests in that area.
Yeah, to get a score
Yeah.
for that area.
I see. Okay, so they had all their data, their definition of what optimal means, and their ways of measuring it.
Right.
So what did they find?
So they found some really interesting things.
Okay, lay it on me.
So first, when they looked at the average scores for optimal functioning over time for both groups, they saw that both groups improved.
Okay, so both groups got better.
Yeah, both groups got better, which is what you'd expect.
Right.
But for the kids with orthopedic injuries,
Okay.
their average score was 6 out of 11 at 10 days.
Okay.
And then it went up to 7 out of 11 at both 3 months and 6 months.
Okay.
But for the concussion group, their average score started lower at 4 out of 11 at 10 days.
So they were worse off initially.
Yeah, they were definitely worse off initially.
Okay.
But then it increased to 6 out of 11 at 3 months
Okay.
and finally reached 7 out of 11 at 6 months.
So they caught up.
They did, yeah.
So they both ended up at the same level of functioning.
Right.
But the concussion group just started out lower.
Exactly.
Oh.
And actually, the researchers found that just the passage of time was the strongest factor associated with improvement in optimal functioning.
Really? So just time was the biggest factor?
Yeah, for both groups.
That's interesting.
But at that first assessment,
The 10-day one?
yep, the 10-day one,
Yeah.
the concussion group had much lower scores for optimal functioning compared to the orthopedic injury group.
That makes sense.
Yeah. And this was true for both boys and girls in the study.
Okay, so it wasn't just like girls were recovering slower.
No, it was both boys and girls.
Okay, so it seems like concussions have a bigger impact initially
Yeah, they do.
than a broken bone or a sprain,
Yeah, exactly.
which makes sense, right?
Yeah, it's your brain.
It's your brain. Exactly.
Your deal.
But what about those later assessments?
Okay, so this is where it gets really interesting.
Okay, I'm ready.
That difference in optimal functioning between the two groups.
Concussion and orthopedic.
Yeah.
Yeah.
That difference was still there for the girls in the concussion group at 3 months.
Oh, so the girls were still behind.
Yes. But for the boys, the difference wasn't statistically significant anymore at 3 months.
So the boys had caught up.
Basically, yeah.
Okay.
But then by 6 months, both boys and girls in the concussion group had similar scores to the kids with orthopedic injuries.
So everyone was back on track by 6 months.
Yeah, pretty much.
But the girls just took a little longer.
Yeah, it seems like it.
Interesting. Okay. And was there anything else?
Yeah, so they found that the boys with concussions were more likely to have higher scores for optimal functioning
Okay.
than the girls with concussions
Okay.
at both 3 months and 6 months.
So even though they caught up by 6 months,
Mm-hmm.
they were still showing a difference at 3 months and 6 months.
Yeah.
Okay.
And that difference between boys and girls wasn't there at all in the orthopedic injury group.
So it seems like there's something about concussion specifically
Yeah,
that might affect boys and girls differently.
it seems that way.
Okay, that's really interesting.
It is.
So basically what this is telling us is that for kids who get a concussion,
Mm-hmm.
getting back to that optimal level of functioning
Right.
across all those areas
Yeah.
might take more than just a few weeks.
Right.
It could even be longer than 3 months, especially for girls.
Exactly, especially for girls.
But the good news is
Yeah.
most of the kids did reach that optimal level within 3 to 6 months.
That's the encouraging part.
Yeah.
Mm-hmm.
Okay, so this is fascinating research.
It is.
But like, what does it actually mean?
Okay, so that's the big question, right?
Yeah.
What are the implications of these findings?
Exactly.
So let's think about that.
Okay.
Okay.
Well, the first thing that comes to mind for me is that this really challenges what a lot of people think about concussion recovery.
Oh, yeah, for sure.
You know, we hear all the time the kids are resilient and they bounce back quickly.
Mm-hmm.
And, you know, symptoms usually go away within a couple of weeks.
Right. People say, oh, they'll be fine in a few weeks.
But this study is saying, hold on.
It's more complicated than that.
Yeah.
Just because those initial symptoms are gone
Mm-hmm.
doesn't mean the child is completely back to their best in every part of their life.
Exactly. And that's a really important distinction.
Ah.
Feeling better,
Mm.
which is what we usually think about when those initial symptoms like headaches go away.
Mm-hmm.
That doesn't necessarily mean that they're thinking their emotions, their social life, and their ability to cope with things are all back to where they were before the concussion.
Right. So their brain might still be recovering.
Exactly.
Yeah.
And these different areas might recover at different speeds.
Okay. So for the parents and caregivers listening,
Yeah.
what's the takeaway message here?
So this study is really telling us that it might take longer than we thought for a child to fully recover after a concussion.
Mm-hmm.
It could be up to 6 months, and for girls, it might even be longer.
Okay.
And that's totally normal.
So it's not a cause for panic?
No, not at all. It's
Okay.
just part of the process.
Okay.
And I think knowing this can really help manage expectations.
If your child isn't fully back to their old self within a month,
Yeah.
it doesn't mean something's wrong.
Oh,
It could just be that their brain is still healing.
that makes sense.
Yeah, and that can really help reduce anxiety for both parents and kids.
Absolutely.
Yeah,
And it's important to remember that it's not just about whether they still have a headache or not.
right.
Right? It's about all those other things we talked about.
Exactly. It's multifaceted.
Okay.
So we need to pay attention to their cognitive skills, their emotional well-being, how they're interacting with their friends and family, and how well they're bouncing back from challenges.
How those things matter.
All of those are crucial parts of the recovery puzzle.
And they might all take different amounts of time to get back to normal.
Exactly. They don't all happen at the same speed.
Okay. And what about this finding that girls might take longer to recover?
Yeah, so that's a really important point.
Yeah.
And the researchers think there might be some biological reasons for this difference.
So it's not just that girls are more likely to report their symptoms.
No, it might be something deeper than that.
Interesting.
Yeah, it's definitely an area that needs more research
Okay.
to really figure out what's going on there.
That makes sense.
Mm-hmm.
So for me, this study has really opened my eyes to the complexity of concussion recovery.
Oh, yeah, absolutely.
It's not as simple as we often think.
Not at all.
It's not just about waiting for the symptoms to go away.
Right.
There's so much more to it.
Yeah, it's about a whole lot more than that.
It's about looking at the child as a whole person
Exactly.
and understanding that full recovery takes time.
And patience.
Yeah.
And careful observation.
Okay, so that's all well and good.
Yeah.
But like every study, this one has some limitations.
Right. Every study has limitations.
So what were some of the limitations of this particular study?
So one thing to keep in mind is that a lot of the measurements were based on questionnaires
Okay.
that the children and sometimes their parents filled out. And while questionnaires are really useful, they might not always be completely accurate.
Because it's self-reported.
Yeah, exactly. It's self-reported.
It's how they feel.
Right. And sometimes how you feel and what's actually happening physically might not match up perfectly.
That makes sense.
Yeah. And another thing is that all the kids in the study were from big city hospitals.
Oh, so urban hospitals.
Yes.
Okay.
So the findings might not fully apply to children in rural areas.
Right, because they might not have access to the same level of care.
Yeah, exactly. Or they might have different experiences.
Yeah.
And even though the study had a good number of participants, they were all from Canada.
Okay.
So it's possible that the results might not be the same for kids in other parts of the world.
Right, because different countries have different healthcare systems.
Yeah, and different culture.
Different cultures, exactly.
So, there could be variations.
Okay, and what about the definition of optimal functioning?
Okay, so that's another important consideration. The standards they used to define optimal were pretty high. Kids had to be at or above average in many different areas.
Yeah.
So some kids might feel like they've recovered, even if they don't meet all of those criteria.
Right, because it's a pretty strict definition.
Yeah, it is.
Okay.
And also remember that for some of the measures, optimal was based on the average score of the kids with orthopedic injuries.
The control group.
Yeah.
Right.
And it's possible that those kids weren't functioning at their absolute best right after their injuries either.
Okay, that makes sense.
Yeah.
So the bar might have been set a little lower than true optimal.
It's possible.
Okay, so considering all of this, what did the researchers themselves take away from the study?
So they believe that their findings could explain why some kids, especially girls,
Okay.
might say they still don't feel quite right.
Even if their doctor says everything looks good?
Yeah, even if the doctor can't find anything wrong.
Interesting.
They think those lingering feelings could be because their brains are still recovering.
Even if they don't have any obvious symptoms?
Exactly.
Yeah.
And they really emphasize the importance of looking at recovery in this holistic way.
Right, looking at the whole child,
Yes, the whole child.
not just their physical symptoms.
Absolutely.
And did they suggest any areas for future research?
They did. They said it would be really helpful to do more research to validate their definition of optimal functioning
Okay.
and to figure out what typical levels of functioning are for kids who haven't had concussions.
Oh, so that they have a better comparison point.
Exactly, a better baseline.
That makes a lot of sense.
Yeah.
Okay, so as we wrap up this deep dive,
Yeah.
what's the most important message you want our listeners to take away?
So if a child, has a concussion, the most important thing is to be patient.
Yeah.
And to pay close attention.
Okay.
Understand that it takes time for their brain to fully heal, and that full recovery involves more than just those initial symptoms going away.
Right.
So keep an eye on their physical well-being, of course, but also how they're thinking and remembering things, their emotional state, how they're interacting with people, and how well they're handling stress and challenges.
So basically look at the whole picture.
Yeah, exactly. Look at the whole picture.
Okay. And what can listeners do practically?
Talk to their doctor.
Okay.
And talk to the child's school.
So open communication.
Yes, open communication is key.
Okay.
Let them know what you've learned today
Yeah.
so they can provide the right support.
Makes sense.
And maybe make adjustments at school or at home to help the child while they're recovering.
Okay, so to leave everyone with something to think about,
Yeah.
what's a question they should be asking themselves after listening to this deep dive?
I think the big question is, what does fully recovered really mean?
Ooh, that's a good one.
Yeah, and this study gives us a framework for thinking about that.
Hmm.
But remember, every child is different.
Right.
So pay attention to how the individual child is progressing in each of those areas.
That's a really important point.
Yeah.
And it
Yeah.
makes me wonder,
What's that?
should we be changing our guidelines for when kids can go back to school and sports after a concussion? Given that it might take longer to fully recover than we thought,
That's a really good question.
especially for girls.
Yeah, it's definitely something to consider.
It is food for thought.
Yeah, absolutely food for thought.
Well, this has been an incredibly informative deep dive.
It has been.
Thank you so much for joining me today and sharing your expertise.
My pleasure.
And to everyone listening, we hope this has given you a better understanding of the complexities of concussion recovery in children.
And remember, be patient, pay attention, and advocate for the kids in your life.
Absolutely. Thanks again, and we'll see you next time for another deep dive.
See you then.
Right.
Bye.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.